Good evening, friends. Welcome back, everyone. Today is Friday, June 26, 2026, and the world of medicine is moving faster than ever. If you want to know how close we are to wiping out aggressive cancers, why Europe is on high alert for a massive public health emergency, or how a single gene might hold the key to stopping tumor growth, you are in the right place. Today, we have 6 massive, game-changing updates from the FDA, the European Medicines Agency, and top global laboratories. Let's dive straight into the headlines that are changing healthcare forever. Story 1, the EMA's major June approvals, diabetes and Parkinson's. Our first big story comes from Europe. The European Medicines Agency, CHMP, just concluded its June meeting and recommended 6 major new medications for approval. First up is Onswick, insulin efsitora alpha, which just received a positive opinion for treating adults with type 2 diabetes. This represents a massive shift in how millions will manage insulin. Second, Parkinson's patients have a major new ally, Hoplodo, levodopa/carbidopa. This formulation is explicitly recommended for adults experiencing moderate to severe motor fluctuations who haven't been stabilized by standard oral treatments. It's all about restoring control and stability to patients' daily lives. Story 2, FDA expands the fight against triple-negative breast cancer. Moving across the Atlantic, the U.S. FDA has just supercharged the treatment pipeline for one of the most aggressive forms of cancer, triple-negative breast cancer. The FDA officially approved sacituzumab govitecanxi, Trodelvy, for 2 separate first-line indications. It can now be used as a single-agent monotherapy for patients with advanced or metastatic disease who can't take traditional PD-1 inhibitors. Even bigger news? It's been approved in combination with pembrolizumab Keytruda for first-line treatment if the tumors express PD-L1. This moves a highly effective drug to the absolute front lines of defense, giving patients a much stronger starting chance. Story 3, uncovering cancer's hidden DNA repair defect, EX01. Sticking with oncology, a groundbreaking study published today in Nature Communications has uncovered a hidden vulnerability in tumors. Researchers have been looking at a DNA repair gene called EX01. When a cell has too much of this protein, it acts like rogue molecular scissors, slicing up healthy DNA during replication. Here's the breakthrough. Tumors with high EX01 levels behave exactly like cancers with hereditary BRCA mutations, even if the BRCA gene is completely normal. Because of this BRCA-like behavior, these tumors are incredibly sensitive to targeted therapies like olaparib and standard chemotherapy like cisplatin. This gives doctors a brand new biomarker to personalize treatment for patients who previously didn't qualify for these specialized drugs. Story 4, the extreme European heatwave public health alert. Next, we look at an escalating public health crisis. The World Meteorological Organization and national health agencies have activated emergency heat health action plans across Europe. France just recorded its hottest day in history with a national average of 30 degrees Celsius, and temperatures in western towns like Polowa peaked at a staggering 43.8 degrees Celsius. With 58 departments on red alert, authorities are warning that extreme heat is no longer just a climate issue, it is an immediate medical emergency, contributing to a sudden spike in drowning accidents and heat stroke. Health ministries are urging the public to treat this with the same seriousness as a disease outbreak. Story 5, long COVID biomarker in J&J's multiple myeloma win. Rounding out our clinical updates, we have a double header of fast-breaking news. First, Ethlin Medical and UCSF published data revealing a novel biomarker for long COVID. They found that patients suffer from elevated levels of specific extracellular vesicles. This gives us a concrete therapeutic target, opening the door for blood-filtering devices like the hemopurifier to physically strip these disease-driving particles out of the bloodstream. Meanwhile, Johnson & Johnson just announced that the EMA recommended an indication extension for Tecvayli in combination with daratumumab. This dual immunotherapy approach engages multiple pathways to treat relapsed multiple myeloma earlier in the treatment cycle, maximizing the patient's own immune fitness. Alpha-gal syndrome, AGS, is an emerging zoonotic disease that manifests as an allergic reaction to the disaccharide galactose alpha-1, 3-galactose, alpha-gal, found in all non-primate mammalian tissue. Alpha-gal is also found in the saliva of some ticks, such as the Lone Star tick, Amblyomma americanum, and is transferred into the body when the tick bites to obtain a blood meal. The introduction of the molecule in the context of the vector bite is believed to trigger an immunoglobulin E immune response in some individuals that recurs when the person encounters alpha-gal again in the future. As AGS is becoming more widely recognized, several other types of ticks have also been implicated in causing this reaction. Medscape. Copper-induced cell death stimulates anti-tumor immune cell response. A preclinical study from researchers at the University of Texas MD Anderson Cancer Center, published today in Cell, details a connection between the immune system and Q-proptosis, a type of copper-induced cell death. The findings suggest a new approach to help overcome resistance to immunotherapy. NewsMedical.net. Cord pH. Cord pH was not associated with later SCN in children born after 35 weeks of gestation who had reassuring 5-minute APGAR scores. Acta Pediatrica. SCN equals special education needs. OBS and Gyne update. Today's top news in obstetrics and gynecology features a historic policy split as the American College of Obstetricians and Gynecologists, ACOG, launches its independent 2026 maternal immunization schedule, diverging directly from federal CDC guidelines. Alongside this landmark medical shift, global health bodies and major medical journals have rolled out critical new clinical updates this week, including a massive global push by the World Health Organization, WHO, for newborn screenings, new perinatal heart failure protocols, and a special focus on maternal morbidity data. Segment 1, Intro and ACOG's historic vaccine shift. For the first time in history, the American College of Obstetricians and Gynecologists, ACOG, has completely bypassed federal agency guidelines to release its own independent 2026 maternal immunization schedule. ACOG pulled out of the CDC's Vaccine Advisory Committee earlier this year to combat public confusion and medical misinformation. The biggest divergence you need to know about today involves the COVID-19 vaccine. While the CDC no longer routinely recommends it for healthy pregnant individuals, ACOG's new standalone schedule firmly places COVID-19 vaccination back in the routinely recommended during pregnancy tier, safe to administer at any year-round timeline and any gestational age. Full-screen graphic breaking down the 4 routinely recommended vaccines under the new ACOG framework. COVID-19, any trimester, year-round. Inactivated/recombinant flu, any trimester, ideally by late October. TAP, firmly targeted at 27 to 36 weeks of gestation. Maternal RSV, a Bristol administered seasonally between 32 weeks 0 days and 36 weeks 6 days. Clinicians take note, ACOG explicitly states that all 4 of these vaccines can be safely co-administered during regular prenatal checkups. This marks a major pivot toward absolute clinical autonomy for OB/GYNs. Segment 2, WHO's new newborn mandate and AHA heart failure warnings. B-roll of the neonatal ward. WHO global call, scale up newborn screening now. Moving on to international health, the World Health Organization, WHO, issued an urgent global mandate this week calling on all nations to aggressively expand newborn screening programs. According to the latest 2 data, an astonishing 8 million babies are born with a birth defect each year, accounting for 8% of all under-5 child mortalities. The report emphasizes that conditions like congenital hypothyroidism, sickle cell disease, and metabolic disorders are fully manageable if caught within days of birth, yet millions are diagnosed too late. The statistics from the American Heart Association, AHA, nearly 1 in 4 women aged 20 to 44 have cardiovascular disease. Simultaneously, the American Heart Association just published a critical scientific statement titled Heart Failure Occurring in the Perinatal Period. Pregnancy acts as a natural stress test for the cardiovascular system, and heart failure during or immediately following pregnancy remains a hidden driver of maternal stroke and mortality. The AHA is urging OB/GYNs to implement rigorous cardiovascular risk profiles early in the first trimester, particularly because lifestyle factors and rising adult obesity are pushing cardiovascular diseases into younger childbearing age groups. Segment 3, Journal Highlights Up to Date, Green Journal, and IJUOG. Let's look at what the top-tier peer-reviewed journals are saying this week. First up, UpToDate refreshed its clinical guide, highlighting new data on light physical activity during pregnancy, which shows significantly optimized birth weights and lower gestational diabetes risks when patients engage in low-impact daily movement. Meanwhile, the Green Journal released its highly anticipated special issue on maternal morbidity and mortality. The core takeaway from this extensive collection of data is actionable change. Up to 80% of maternal deaths are entirely preventable with standardized obstetric emergency protocols. The issue focuses heavily on clinical interventions for postpartum hemorrhage, PPH, and severe preeclampsia. Summarizing intrauterine transfusion (IUT) outcomes: 81.1% preterm birth rate in complicated cases. Standalone therapy requires careful patient selection. Over in Fetal Medicine, the journal Ultrasound in Obstetrics and Gynecology (UOG) published a systematic review on pregnancies complicated by fetal anemia secondary to placental or fetal tumors. The data shows that while intrauterine blood transfusions are a viable intervention, these cases see an 81.1% rate of preterm birth. The authors warn that standalone transfusions carry high perinatal death risks due to underlying tumor complications, requiring intensive, multidisciplinary maternal-fetal medicine tracking. Segment 4. Global Public Health and Maternal Healthcare Infrastructure. Global Summits and Public Health Achievements. Right now, the global OB/GYN community is wrapping up the major World Summit on Women's Health and Gynecology in Rome. The massive talking point echoing through the halls of the summit is the integration of precision medicine, P5M, which focuses on predictive, personalized, and participative care paths for high-risk maternal patients. On the public health front, South Asia is celebrating major structural milestones. India's flagship maternal initiative, the Pradhan Mantri Surakshit Matritva Abhiyan (PMSMA), has officially marked a decade of operations. New data reveals the program has provided free, specialized antenatal care to over 7.5 crore pregnant women, showcasing India's maternal healthcare progress. Maternal mortality ratio (MMR) dropped significantly from 130 down to 87 per lakh live births. Institutional deliveries: over 90% of births now occur in safe medical facilities. The data proves that when you move high-risk pregnant patients into structured medical facilities with competent birth attendants, maternal mortality plummets. However, the report also notes a dual burden. While undernutrition is dropping, lifestyle-related risks and adult obesity are climbing sharply, presenting the next major hurdle for modern obstetrics. Segment 5. Rapid-fire clinical reminders for students and residents. High-yield clinical updates. To wrap things up, let's look at some rapid-fire high-yield updates for residents, board candidates, and practicing clinicians following the latest FOGSI and international board reviews. Hypertensive disorders. Remember that pregnancy-induced hypertension, PIH, is formally an Pregnancy-induced hypertension, PIH, is formally an outdated umbrella term. The current strict classification requires you to diagnose patients with either gestational hypertension, preeclampsia, chronic hypertension, or superimposed preeclampsia. Also, there is no mild preeclampsia clinically. It is classified strictly as severe or non-severe. Gynecologic oncology, cervical cancer staging remains a critical focal point under the updated FIGO guidelines. Ensure you are screening utilizing co-testing models where available. Reproductive medicine, infertility management focus heavily on the Roundup criteria for polycystic ovary syndrome, COS, and the expanding field of reproductive immunogenetics to solve unexplained euploid embryo implantation failures. Summarizing, from revolutionary diabetes management to smarter cancer biomarkers and emergency climate health actions, today, June 26th, marks an extraordinary day for medical evolution. Modern healthcare is shifting from a one-size-fits-all model to absolute precision medicine. Which of these breakthroughs do you think will have the biggest impact? What are your thoughts on ACOG splitting away from federal CDC guidance? If you are a practicing clinician, how will this alter your clinic's vaccine counseling this week? Drop your thoughts in the comments below. Don't forget to hit that subscribe button, turn on notifications for daily medical updates, and smash the like button if this script helps your practice or your studies. Stay safe and keep caring for your patients. See you in the next video. Sources: the cancer insights come from the latest June 2026 issue of Nature Communications. Drug details are pulled directly from the European Medicines Agency, EMA, and FDA portals, and the heatwave metrics are from the official World Meteorological Organization, WMO, press room. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.